Good evening, everyone. It is indeed my pleasure to welcome Miss Nandini Sajju Jayani, alumna of our institution, for our next session. Miss Nandini completed her master's in English Language and Literature from Amrita School of Arts and Sciences, Kochi, in the year 2020. She went on to pursue master's in psychology from Sheffield Hallam University and got graduated in the year 2021. She was recently awarded with the membership of British Psychological Society. She has been a part of several national and international conferences and has also published papers in acclaimed journals. Her areas of interest include counseling, clinical psychology and health psychology, gender, sexuality studies, and Dalit literature. I wholeheartedly welcome Ms. Nandini to preside over this session. Thank you.
I feel so privileged and even more excited to be part of Vidyamritam, organized by my own department, I would say. And I would like to thank Dr. Sreena ma'am for inviting me and giving me an opportunity to be a part of Vidyamritam of this year. And uh, to be very frank, exactly 2 years back from now, I was there, one among you people sitting back there in a chair listening to every sessions organized by my department. And this Amrita School of Arts and Science and Department of English Language and Literature has always been there for me, helping me to migrate to England and also um, backing up my career in psychology. And they have always been a root cause of my growth. And today I'm here to talk on the psychological and social impact of COVID-19, which we have been going through for last few years. And I know like we are so deeply affected by it. And let me start with the paper now. Um, so the COVID-19 though, or the coronavirus disease outbreak has affected not only not only our physical health, but also our mental health and psychological well-being. So the studies have suggested the impact of pandemic and the lockdown measures on young persons for several mental symptoms such as anxiety, stress, depression, and even specific distress, decrease in psychological well being, and change in the sleeping habits. So, the psychological symptoms were related to the experience of several stressors, actually, such as the reduction of academic perspectives, massive e learning adoption, economic issues, social restrictions, and the implications of daily life related to the COVID-19 outbreak. So it is important to point out the negative psychological impact of the pandemic outbreak and the high vulnerability of the young in the development of psychological distress, thereby highlighting the relevant focus on the mental health of young people during the pandemic and the need for a structural and also a tailored psychological support and intervention focus for the improvement of the quality of life, to be exactly the quality of life of the most exposed group, that is the children, college students, and the healthcare workers who are more likely to develop the post traumatic stress disorders, the anxiety, depression, and other symptom of stress. Uh, to be frank, the social distance and the security measures have affected the relationship among people and their perception of empathy towards others. Talking about from that perspective, telepsychology and technological devices assume important roles to decrease the negative aspects of the pandemic. So these tools present uh, benefits that could improve the psychological treatment, because when I work in a clinic, I really understand like it is like we can't go and have a talk to the patients and face to face, but it's all through the technological devices, and these tools present benefits that could improve psychological treatment of patients online, such as the possibility to meet from home or from the workplace saving money and time, and maintaining the relationship between the therapist and the patient. And as we all know, the COVID 19 is highly infectious disease, often including very acute respiratory syndrome. We all know the history, like it started or it was identified in Wuhan and in China. In the following months, the infection spread across other countries around the world as an emerging global health threat. So, the clinical features of COVID 19 are varied, ranging from different state of acute respiratory distress syndrome and multi organ dysfunction. Human to human transmission occur through common pathways such as a direct transmission, contact transmission, or airborne. So, as we all know, the cough, sneeze, droplet, contact with oral or nasal, eye, mucus are the common mode of spread, as we all know, because it's been 3 years and we are all so familiar with it. So, COVID 19 provokes significant challenges to curb the spread of infection and maintain global health security. Due to the rapid spread of the virus, many countries implemented a range of anti epidemic measures, such as keeping physical distance. As we all know, many of you have been sitting at home and doing your college life, isn't it? So we all are so familiar with it. So the rapid spread of COVID 19 and the many measures taken by the organization, like social and physical distancing, wearing face masks, the quarantine and lockdown restrictions to contain the transmission and avoid the contact with others, have actually helped in a way, but in other way it had affected people physically and moreover mentally. The pandemic has a devastating impact on the global economy and the health of communities across the world. Furthermore, the COVID 19 outbreaks have affected not only the physical health but also the mental health and well being. So, the COVID 19 pandemic has severely affected the entire general population. Even the younger minds have not been spared from the changes of the unprecedented situation. So, this is not the first pandemic that we or the world is going through. There's been influenza, the H1N1, or the Ebola pandemic, and these all are already revealed the mental health issues or how it is affecting the mental health of people around. So based on these previous things, researchers conducted several studies to investigate the consequences of COVID-19 pandemic on mental health in specific groups or in a general population, but it is mainly done among the students or the children or mainly the healthcare workers, because they are the most affected group in our society. So, studies on pandemics faced over time, such as there are studies on SARS, Ebola, H1N1, equine flu, and currently the COVID-19 shows the psychological effect of contagion and quarantine is not limited on a fear of contracting the virus. There are some elements relating to pandemic that affect more the population, such as separation from the loved ones, loss of freedom. We were subjected to be on inside the four walls actually. So the uncertainty about the advancement of the disease and the feeling of helplessness. These aspects might lead to dramatic consequences, such as the rise of suicides. So that was a common element that I have seen in whatever place I am right now, because the cases that coming to my clinic or wherever I have been working was the mental distress and their temptation or their uh, their feeling of committing suicide. So the suicidal behavior are often related to the feeling of anger associated with the stressful condition widely spread among the people who lived or live in the most affected area, because they live in a constant fear of what is happening next. So in the light of these consequences, a carefully evaluation of the potential benefits of quarantine is needed. So taking into account of high psychological cost. So there has been many surveys going on for the understanding of the well-being, the psychological well-being during the COVID-19 pandemic. And it was found that children, especially the students and young adults, are particularly at the risk of developing this anxious symptoms. There was a research in um, Italy and Spain. It was a comparative study, and the research involved like 1,143 something parents. And in general, the parents observed that emotional and behavioral changes in their children during the lockdown or the quarantine time was very high. Symptoms related to difficulty in concentrating, because we all are like so much into the social media, and in a way, or like a side effect, it is actually affecting our concentration. So it's like, and the symptoms relating to the difficulty of concentration, boredom, irritability, restlessness, the complete wanting for going out, and the sense of loneliness. That's the most affected thing, the sense of loneliness, and the uneasiness and the worries. From the comparison between the two groups, the Spanish and the Italian parents, it emerged that the Italian parents reported more symptoms in their children than the Spanish. So I can't say like one place is showing more psychological distress than the other. It can definitely vary, but it depends on what all measures are taken to support the people mentally and also physically during these lockdown times. So on the contrary, having infected relatives or acquaintances lead to the worsening in anxiety symptoms. So when I came here first, I started to live with my family. So uh, I was affected by COVID first, and the whole family out here was mentally affected on it, because they are in a constant fear, like whether they will get infected or not, or um, yeah, the constant fear of their loved ones being in pain. So we go through many things when a pandemic affect a family. So um, yeah, this is one thing. And furthermore, the economic problems and the slowdown in academic activities are related with anxious symptoms. So uh, it's like from school time on, we have a general routine, like we used to go to school, come back in the evening, we spend time with the family, and everything went in vain when a pandemic hit. And it's like we used to sit for the last 2 years, we used to sit at home, we have nowhere to go. So our life actually shrinked into a four wall, and the social communication has shrinked. So in these all resulted in the anxiety symptoms or the stress symptoms. And to overcome all these, the therapist or the psychologists in your society have been implementing many uh, solutions. And actually that all were helping, I would say. And in addition, an online survey conducted on general population in China found that the college students are more likely to experience stress, anxiety, and depression than any others during the pandemic, because the daily routine is affected, like we can't go out, can't meet friends, can't attend our classes. losing all our college life and memories, isn't it? So these were really, not only in China, I would say, it was affecting everybody out there. And these results suggest that monitoring and promoting mental health of youth in order to reduce the negative impact of quarantine is very important. And to talk about the healthcare workers, like the doctors, nurses, and the care workers, are another segment of they are another segment of population particularly affected by stress. They are always in a constant fear, like whether they will get affected or not. Should they get back to their home after treating the patients, because they are more concerned about their family. So the healthcare workers are at the of risk to develop symptoms and in common catastrophic situations such as the post-traumatic stress disorder, burnout syndrome, and the physical and the emotional exhaustion, and depersonalization and the dissociation. It's like uh, the main thing I found during lockdown and coming back here is um, people are getting more negative. People are being more negative on things, like they are having a post traumatic stress disorder. They are always in a hangover of what happened in the past, and um, the boredom have really strike them. They really don't want to go out. They don't want to have a social gathering, even though they say like they need some social gathering and a space out there in the society. Things have changed because they have been very much comfortable in their households, sitting with their family, and having a personal life, to be exact. So people have found the comfort in the four walls, and it was hard for them to to break the walls and come out after having a normal life out there. So it's like, however, epidemic presents different peculiarities compared to the catastrophic event. For instance, the stigmatization attitudes in the particular towards health professionals who are in daily contact with the risk of infection. Yeah, so it is like, I would say they are the most affected people during this pandemic. However, an epidemic during the SARS, up to 50% of, according to a study, up to 50% of the healthcare professionals suffered from acute psychological stress. Because while I was working in a hospital, I could see like the nurses and the doctors continuously going through a 14 hours or a 24 hours shift, and having a having an exhausted life. So from the psychological stress, exhaustion, and the post traumatic stress caused by the fear of how their family members will be affected, and this prolonged isolation without seeing the family have really affected them. As a consequences, the healthcare professionals who were overworked suffered high level of psychological stress. That's what I said. I have seen many people doing a 14-hour shift or a 24-hour shift and staying away from family without knowing about them. It's actually a kind of mental distress, and um, I don't know how far it can be treated, because it's only through the talks that we could help them in person, but still, even inside within them, they have a longing for their family, to sit with them and to have some time with them. But the shift hours have definitely never let them do it. So the health professional also lived or live in a daily traumatic condition. And this is called the secondary traumatic stress disorder, which describes the feeling of discomfort experienced in the helping relationship when the treatment are not available for all the patients, and the professionals must select who can assist them and who cannot. Because if a person is having asthma or acute respiratory problems, they have to take different measures to help them. Maybe some medicines can't be used to them, Some medicines are can be very allergic. So it's like they have to go through many things before treating a patient, and these kind of thoughts have caused many traumatic stress disorders in the professionals, and this have actually affected many out around the world. That's what I should say. And there have been many surveys on the healthcare workers, and it was seen like they are on the third line ward, showing the high percentage of depression, anxiety, insomnia, and distress. Also, the constant fear lead to obsessive thoughts and increasing the progressive closure of a person, reducing the social relationships. And the other session of the society who got affected by this pandemic is the women. So to talk about them, women are the most likely to be affected by anxiety, depression, distress, and also found a relationship between their age and distress, depressive symptoms associated with the pandemic. We know, like we all know many homemakes, and some of our mothers are homemakes, and but even then they wouldn't have been going through such traumatic stress, uh, because they have some in the family who's going out every day and coming out with some happy news or whatever things like happening to them on their daily basis. But women who were so affected because they were having all their close one in and around them, and they could they I would say they get more affected because they see and they personally experience a feeling like their loved ones are affecting the most. So indeed, the medical staff of younger ages, the woman staff of younger ages reported increased stress due to the patient death because they are more mentally affected. Rather, we call women a weaker sex, but never a weaker sex, because they go through many things and they find the kind of relief in everything. So the reported stress due to the patients, that the prolonged work hours, uh, their physical changes like the menstrual cycle and the lack of personal protective equipments, because maybe some are carrying, some are breastfeeding, um, some might go through their monthly stress, and uh, and as we all know, most of the nurses are female, so they are the most affected group in our society because of this pandemic. And there have been many uh, telepsychology solutions for psychological well-being, and in order to reduce anxiety and depression symptoms was spread among the population. The WHO, the World Health Organization, and the Center for Disease Control and Prevention, and in 2020 proposed a significant guideline for the correct use of health protection, with the aim to minimize the stress association with the healthcare professions. So the psychotherapist provided psychological support, basically through online, addressing to the technological challenges, and the technological development in mental health actually foreshadows future trend that includes smart mobile devices, cloud computing, the virtual worlds, virtual reality, and economic game. In addition to the traditional psychotherapy tool, there are many online tool, but before this pandemic, we believe kind nothing is very effective on people, because the doctors or the therapists always believe like the person to person contact is actually very important for treating people. Uh, but the telepsychology actually have really helped everybody out there. in this perspective, it is important to help the future generation of psychologists and the patients to collaborate in a potential growth area through educating and training on the benefits and the effectiveness of telepsychology. Indeed, um, more awareness on the potential of the online service is needed, and exploring the main differences between the device like chat, video, audio consultations, etc., in order to use them in a relation to a specific, or it should be identified by the professional. So, on this line, a significant example um, is one of a study proposed by the PhDs in Virginia Commonwealth University. Was that it's with the aim of training future psychologists in managing the psychological effects of the pandemic through an online service. Even now, if we apply for a job, we see like there are many online consultations, and uh, I think one of the famous one is BetterHelp. If we register, they will assign us with a psychologist, and it is very important that someone should be there to hear all of us. So they will assign a psychologist, and we can go through many sessions through online. They will listen to whatever problems we have, and they gives us a solution. So there have been many online platforms to help the people psychologically, and yeah, um and support their mental health. So the service provided by the Virginia Community Commonwealth University have been very effective in reducing anxiety, depression, and the hospital recoveries. So, telepsychology assumes a key role in the development of healthcare. Actually, online psychological services avoided the geographical barriers and are suitable to become a useful i- kind of integrated tool in addition to the traditional treatment that have been going through for all these years. So, online psychological service provides several advantages, especially in the current situation of pandemic. Um, First of all, the online service help people in short period of time, reducing the risk of condition and the strong feeling of anxiety or loneliness in both psychotherapists and the patients who feel uncomfortable in doing traditional psychotherapy practice, that is a face to face practice, due to the pandemic. So even now, even if we are getting back to normal, many people out there, especially the old age people, um, they still worry about going out and seeing people face to face, and um, spending time. So it's been it's been a boon, like uh, finding such a tool have helped everybody out there to helped everybody out there to get a person or a ear to hear them. So, according to this situation, the online services could provide a different medium. So, for instance, the chat is a very useful tool to establish the first assessment of a person who feels very uncomfortable in using a video call. So, uh, what I have personally identified is like many people find it very difficult to come in a video call or face to face chat, especially in a video call, because they are very much anxious about how they look. Not only their what to say, like the pandemic distress, but also their physique, that they are very much concentrated into. So many people are very shy, or not even interested to come and have a video call appointment. And indeed, the online psychotherapy is perceived as more acceptable, though, because even through chats, we were providing psychological helps to many out there, and each person, I would say, would have a different experience of the network and several level of disinhibitions. For instance, a mild disinhibition could be a person who choose to ask for help, talking with the psychologist about their problems, while a high disinhibition could be presented by flaming an expression or experience on online bullying or cyber talking. So, if we are seeking help for one thing through a video call or something other can trigger up. So it's always like one when getting one when getting a solution for one problem can give rise to another one. So many people out there were very much distressed to come on a video chat or anything like that. So but even then, there are some advantages of telepsychology, such as the decrease in waiting for consultation. That's the main thing. Uh, to be very frank, back in our place, we can just walk in or take an appointment very soon. But in a country like England or in UK or any other part, the first thing we have to go through is like we have to go and see our, even we can't see the general practitioner, but from 8 in the morning we have to call the GP, get an appointment, and it's been always hard to get an appointment. So the telepsychology, um what should I say, like broke all the stereotypes and decreased in the waiting of consultation, because it takes place from home and from the workplace, or it helps in saving time and expenses, and it's all of less travel, the rental cost. It, it has really helped many out there who provide the service and for those who use it. So as reported by many others, online psychological services facilitate access to people who struggle to find support close to their social environment, avoiding the difficulties related to mobility. Also, this online services help people who have less confidence in psychotherapy. There are people who don't believe in psychotherapy even now, and yeah, it have even help people who have less confidence in psychotherapy. Indeed, mostly online psychotherapy takes place in one's comfort zone and facilitating the expression of problems and feelings. So being in a comfort zone is actually very important when you talk with a psychologist. So online psychological services, I would say like it should be integrated with various territorial services in order to provide the patients local references in relation to a specific health and the economic needs. So finally, the possibility for therapist and the patient to record the session is actually a good thing. It's really a good thing because recording a session can actually keep in mind what all the patients have gone through and how their mental health growth is um, marked after each session. Uh, so the what should I say? It should be integrated with various tutorial services in order to provide the patients local references in relation to the specific health and even the economic needs. Um, so on this perspective, online psychological support and psychotherapy became a source of psychotherapists and patients um, in a co-build relationship. So there has been many sufferings and empathetic problems psychologically, and there have been many social sufferings during this time. So in analyzing the psychological impact of the quarantine, the importance for individuals to feel integral part of the society emerged in one way or another. And as an aspect often undervalued in psychological well-being, that is what I have pinpoint. So experts of public health believe that social distancing is better solution to prevent the spread of virus. However, although it is not to predict the duration of the pandemic, we knew very well that the serious impact of these measures on the society or on the relationships or on the interactions, in particular of this empathic process. So uh, to be exact, in the early 90s, empathy was described as a form of identification in the psychological and physiological state of others. So, this definition lead to a debate between the principles of psychology or principles of philosophy. Uh, it is between the principles of psychology and the principles of philosophy. That's what I want to say. And also, human communication has been changing. Somewhere going so silent, somewhere becoming um, ambivert, somewhere some went through many things and becoming more introverts. Like human communication and what their behavioral changes were very evident during this time. So the formal questions that we ask when we see somebody, like "How are you?" at the beginning of conversation, is no longer just a formality right now. So when we ask "How are you?" to some person during this time, it's all about like we are expecting them to tell like they are feeling okay or free. They are stress free. That's the exact word. They are stress free. For example, the relationship between employer and a manager is very different after a pandemic. So, leading to more responsibilities in listening and understanding the feelings expressed during the video calls or generating a forced reciprocity is it was all noted during this lockdown time or the pandemic time. So, hence the forementioned or the forced empathy may be common in the spirit because the social distance and the emergency situation that people make want to be heard or appreciated, and the simple question how are you becomes a anger to express fear and emotion nowadays. So to conclude on things, the COVID pandemics have affected the way of people live, uh, the way people live, and their interpersonal relationship. So the lockdown was characterized of a different organization of daily life, uh, and with the incrementation of time at home and the reduction of distance through the digital services. This period was also seen as an evolution in the concept of empathy, producing new perspectives in the study of phenomena according to the sociological as well as a neurological point of view. So, indeed, I would say empathy is very much important in one's life. So, indeed, empathy, defined as the ability to understand and share the feelings of another, involves several elements such as the social context and the historical period of an individual. So, uh, as we were all on inside the four walls, there should have been many people going through the psychological effects, like they might have been going through some psychological stress even before, like a sexual harassment or a domestic abuse or many such things. So these things can be triggered during a lockdown because um the abuser can be in their home, and there would have been a series of abuse during the lockdown because nobody is getting to know anything. So it is always the empathy that work out during this particular period of time. And There are also the several elements like the social context and the historical period of an individual, the neurological system, and the psychological and behavioral responses to the feelings of others were all affected. And the the neuropsychological perspective analyzes the mechanism involved in this empathetic process, forcing people of human communication and the interpersonal relationship. So we live increasingly in a human machine world now. Anyway, anyone who doesn't understand this and who's not struggling to adapt to a new environment, whether they like that environment or not, is already being left behind. So, adapting to the new, the fast changing, or the technologically advanced or enhanced context is one of the major challenges of our times, and that currently goes for our education actually. So, uh, even now, I know like you people are back to your college, and many have missed their college life in between. So I'm a well, like a pandemic pass out person, so I know like many haven't gone through their convocation, many haven't seen their friends for during the last days of their college or university life. So it's all like it can or it will mentally affect us, parting our loved ones, and the loss of freedom, the boredom, the striking boredom. So it's all like the psychologists and the society are working on it, and they are bringing out many solutions to support you people out there. And this becomes a two-way communication. Only when it is a two-way communication, it becomes more effective. So I would say, if you go through, or ultimately we can come out of all this, and for sure we are getting back to the so-called normal. So yeah, that's all. Thank you.